So, good morning, everyone. It's an honor to welcome you all to this special session. Today, we are deeply privileged to be joined by Dr. Osama Hendi, award-renowned endocrinologist and researcher. Dr. Hendi is the Director of International Medical Affairs, Medical Director of the Obesity Clinic Program and Inpatient Diabetes Program, and an associate professor at Harvard Medical School. His contributions to the field of diabetes and obesity management have had a profound global impact, especially in redefining standards of care and integrating innovative therapeutic approaches. So it's truly an honor to have him with us. Thank you so much, Dr. Hendi, to join us today. It's a really pleasure to have you here. My name is Gabriela Lago, and I'm the International Director of MEDBRASIL, a medical education institution committed to excellence in post-graduation training for physicians across Brazil. And I'm currently based in Toronto, Canada, and it's a pleasure to lead our global initiatives here and have you as one of our speakers for our students. Thank you so much. I really appreciate it.
Hi, Gabriela. It is a pleasure and honor to be with you and with all the audience for your education programs. I will be more than happy to share with them a lot of what we learned over years here in Boston and in Harvard.
Sounds good. Sounds good. To begin, Dr. Hendi, we love for our students to get to know a bit more about a person behind such an impressive career.
It is a pleasure. You know, I have been in diabetes field for almost 40 years, and I did my practice in 4 countries. I grew up my early life in Egypt. I was teaching in the university in Egypt. Then I get training in Germany on insulin infusion pump and technology of diabetes in the very early stage. That back in 1989. And then I was a physician and director of the Department of Medicine in Saudi Arabia for around 6 years. And then I moved to US and I have been with Joslin Diabetes Center at Harvard Medical School for almost 28 years. And this is my place of work. I treat people with type 1 and type 2 diabetes. At Joslin, we care for around 25,000 patients. And under my care, direct care, around 1,500 patients with type 1 and type 2 diabetes. I do a lot of clinical research around weight management. I created several programs for diabetes weight management. Among them, the famous Y Weight program or weight achievement and intensive treatment. And we have another new program called the DROP program, diabetes remission outcome program that aim to put diabetes into remission, especially when it is diagnosed early within the first 5 years. And also for almost around 11, 12 years, I directed the inpatient diabetes service. We restructured the entire program at Harvard, and we introduced several protocols for management of people with diabetes in the hospital. I have been involved a lot with technology of diabetes, and currently I am the world third most cited physician on diabetes technology by Google Scholar. So I did a lot of work on insulin infusion pump, artificial pancreas, continuous glucose monitors, and I did tons of publication on that. I have more than 150 publication in the area of diabetes and obesity and the impact of weight loss on cardiovascular disease. And I was part of 2 major studies. Most people know the diabetes prevention program in the US, and also the Look Ahead study, which is the biggest study in diabetes to see if weight loss can prevent cardiovascular problems. I do also some clinical trials on drugs, especially GLP-1, and a lot of research on nutrition as well. And I had been part of all the transformation in the nutrition advice and guidelines.
Dr. Osama, I'm very impressed for your background and also for your dedication to the studies of the diabetes and your topics. You're diving into your life. It's really incredible and also an honor to our students in MEDBRASIL have you here with us with this interview. Thank you so much. I really appreciate it. It's incredible. And something that we believe is about the continuing education. And as we can see, even though you have your all that background, you still researching, you still working for, you still study and going to new technologies, new scientific discoveries. So I think this is something really important to show our students they need to keep doing, they need to keep studying, they keep doing better to themselves and for the patients as well. So this is really interesting. Thank you so much. So we are very excited about the lecture you soon deliver to our postgraduate students in endocrinology. And also we were discussing about the topics we could have for our students, but of course, you're the best person to let them know what they are facing to.
Yeah, first, you said it very, very well. Education and clinical research or research in general are the driver of the advance in medicine. And, I work at Joslin, and Elliot Joslin, who founded the Joslin Diabetes Center more than 120 years ago, has a very nice saying. He said that patients who know more live longer. So it is not just education of the physician, education of patients as well can keep them alive for very long duration because they know about their disease and so on. And I personally believe that every physician in a specialty should be at the cutting age of research and knowledge and transform all this information to their patients, whether in the method of treatment or in educating their patients in a proper way. I am planning to share three major topics in this session. The first one will be about diabetes. Why people develop type 2 diabetes? Why the prevalence of diabetes is going significantly high? What are the pathophysiology behind diabetes? And then from that, we will discuss also a new idea of how we will classify diabetes in the future. Not just a type 1 and type 2, but what are the phenotype clusters and how the genetics will play a major role and how we can use artificial intelligence and machine learning technology and all the technology that we have right now to reach a precision medicine. How we can define the medication and the treatment that's set for a specific person and be effective in that person in the much better way. In the second lecture, I will talk about the weight management in general, how the approach for weight management, how we can achieve a long-term weight management and weight loss through conventional way. And as I mentioned, we have several programs for diabetes management by weight reduction, and also have programs for diabetes remission by intervention. So in that one, we'll discuss a lot about nutrition and the fundamental of nutrition and how we can use nutrition as a therapy. That's what's called the medical nutrition therapy. And I will share the results of short-term and long-term data that we have about maintenance of weight loss for longer duration, how people can achieve that. In the third presentation, I will talk about medications. We know we have newer medication for weight management. A lot of people heard about those medication now. And in the pipeline, there are several others. So we'll touch base about what is coming in the future. and how those medication are used and how the results looks like. But the most important, we'll talk about the pros and cons and what is the benefit that we can get, what are the drawbacks that people have to pay attention to, and how this medication will play a major role in our decisions in the future in diabetes management and in obesity management.
Those are very interesting topics, Dr. Osama, and also makes me think about the technologies that you already told us a little bit you're going to dive into. But I was thinking, in your opinion, as the technology advances, especially with the integration of artificial intelligence in medicine, new ethical dilemmas arise. So from your perspective, what are the main ethical challenges we face when we use new technologies in medicine? What's the challenges for the new physicians?
Yeah, so we agree or we don't agree, technology will play a major role in the future. So physicians who are entering the medicine market right now, whether they are physicians or surgeons, they will extensively use technology in the future. Like, for example, surgeons will use more robotic surgery, and there is a lot of AI also for identifying tumors and the best method for treatment and so on. But in medicine, there will be a huge contribution of technology, and especially with artificial intelligence. We are working now on a model called Copilot, diabetes Copilot, and the idea for the Copilot is that how we can use patient informations with lab information and with genetic information to lead to a precision medicine. What I mean by that, there will be a lot of information that will come to primary care physician on ease. It will tell the primary care physician, your patient and so, treatment for your patient will be that and that. The complication will be this and expected in that way. How you will follow them, what is the plan, what is the handouts that you have to give your patients. All the material that will help their patients. But we keep the physician as a pilot. So the physician is a pilot. He will make the decision, the final decision. But now, instead of having one minor resources, they have plenty of resources. So imagine that you are a physician now seeing me as a patient, and all the information comes to you directly saying that Osama is in that phenotype cluster. Osama will develop that complications at that time frame. Be careful about that. Here is what you will do. If you give them life, if they give Osama a lifestyle, be careful about that and that. He liked that. He doesn't like that. He can do that. His compliance and that much. All the information that you will need, it will be in a golden plate coming to the primary care physician to implement them. I needn't to say that in the future, even everything will be automated, but let us just not be in a fantasy of full automation, but reality right now, primary care physician need that technology. And the reason is that if we calculate the number of endocrinologists in the US now, it's 5,700. They are treating 40 million people with diabetes. So this is unsustainable. This is, one physician to around 33,000 or more. So we need primary care physician to have the expertise. But, if you need expertise to treat diabetes or endocrine problem, you will take 7, 8, 10 years of education and training. So imagine that we cut all this period, we give you a lot of intensive information about your patients in a much easier way. So that's how the technology will be. Plus, artificial pancreas. In the future, we'll treat with type 1 diabetes all by artificial pancreas, closed loop, that will collect all the blood glucose level, calculate the insulin, deliver the insulin, all automated. We have a hybrid closed loop. We have 5 different hybrid closed loop now, but in the future it will be a full closed loop, no intervention from the patient side at all. Right now there is still little, but in the future, so technology is catching up, and maybe we can have another fourth lecture about whole technology and how technology will shape the future, because everyone graduated now will extensively use technology. Just imagine the internet when people don't know any internet, and then everyone is using internet. No one knows cell phone. Now everyone is using cell phone. That's how technology will be in the future.
That's right. It's really good when we hear about the technology from you, Dr. Osama, because as you told us, you have like a huge background facing a lot of diverse countries, cultures, and also technologies and researches and studies, and of course different time life also. So nowadays we're more exposed to the AI technology and other technology that is increasing all the time. And something important, as that you said, is going to be helpful for physicians, for the primary care, and also they can focus something very important into the patient. So this is the most important thing. So they can have something to help them to choose the symptoms and the medications, and increase the opportunities to have a better way to treat that patient, but also focus directly to the patient about what they're feeling and what's going on, and take care of them in other parts. I think is going to be a new opportunity for physicians to learn and develop other skills.
So, Gabriela, let me explain something which is very interesting. What technology will do in the future is it changing the start line. Okay, so right now the start line is when patient come to physician interview, get information, do investigation, and then manage patient and give them some technology to use. The start line will move way before. So before the physician, before the patient come to the physician, all that information will be collected, all the lab will be done, all the technology will be done, all the genetic will be done. And then when they come to the physician, no wasting of time, everything is known, and the physician starts from now planning all the future for them. Rather than gathering all the information and analyze all the information, technology will do all of this at the beginning. So start line will move earlier than coming to the physician to do it. So that's how I view the technology in the future.
Yes, definitely. It's really it's such opportunity for all physicians to learn new things, and also the opportunity to understand the technology is not to replace them, but is help them to become better. It's very point of view. I really like your point of view, and I didn't thought about to put the process faster. I was thinking just about the human parts, but you talk about to be faster, to be more precise. This is a really thing, is a point for all of our physicians, especially in Brazil, because they're facing a lot of challenges every day, and technologies is coming all the time, and we can see ChatGPT and all the artificial intelligence just popping up all the time, and they need to understand that they still need to study. They still need to get into the process and understand the technology is going to be there for help them, not to replace them or doing something that they should done. So I think is a good point of view. And also talking about Brazilians and our perspectives in Brazil, I was just thinking about it, your background. You said that you spend your life in 4 or 5 countries, and facing a lot of different cultures and environments and technologies and everything, of course. And as we know, the medical practice in US is globally recognized. And for the integration, the technology, the research, the researchers, the innovation for different kinds of things, and also evidence-based research. In your opinion, how the American experience can, both practical and academic, of course, can inspire our valuable Brazilian physicians
That's
in
very, very,
Brazil?
that's very, very good question. Yeah. First of all, I went to Brazil several times, to Rio many times, and São Paulo many times, and other cities, and even Brasilia and others. So I had been in Brazil many, many times, and I have a lot of colleagues and friends in Brazil. And I am deeply interested in the transculture management. So almost 15 years ago, we created what's called transculture diabetes nutrition algorithm, or TDNA. And the idea is that how we can translate everything that we know and apply to suit different cultures. And in that way, we met with thought leaders in every country, and we started to formulate certain pathway that we are using here to be adapted to the culture in their country. And one of them was Brazil. And we have publication that came from Brazil on transculture. Actually, we finished up till now 29 countries across the globe. Because food is different, activity is different, hobbies are different, motivation are different. And it is very difficult to say whatever play here will play exactly the same way in Brazil or in Mexico or in some other country. It's very, very difficult. We have to suit everything that we know to the culture. For that reason, we created a transculture chapter in the American Association of Clinical Endocrinologists, which is actually dealing with that part. So in my presentations and in discussion, I hope that will follow this presentation, we'll start to brainstorm how we will implement many of what we discussed in Brazil, in the Brazilian culture. You know, not all the medication that we have are there. Not all the food that we use is the same. You know, there is a lot of stuff, but the fundamentals are always the same. So that will enrich the discussion in a very efficient way after those presentations.
Wow. That's good. That's good to hear. It's really good, especially like I'm Brazilian. I'm in Toronto, Canada, and I have my habits, but I'm still dealing with other place, other weather, other language, other everything. But I'm still Brazilian, and I have my habits. So if the physician know that I have a certain background, certain hobbies, habits, I think is gonna help them to understand more about what's going on with me as a patient. And I think this is important for all physicians, not just in Brazil, because nowadays everyone is going to everywhere. So we can work from everywhere. Like we are having an interview right now. You're in Boston and I'm in Toronto, but at the same time we're talking about Brazil. So this is a kind of interesting thing to think about it.
Gabriela, let me give you a very nice example. In our weight management, exercise is a very important and major part. Okay. So when we went to Latin America, not a lot of people are doing a lot of exercise. And we started to see what is going on, what are the barriers. People are hard workers, they don't have time, they don't, they cannot commit, they cannot afford to go to gym or here or there. And then we start to say, okay, what about dancing? And we found that everyone loved dancing. And I said, okay, dancing is a very, very good exercise. So after a tiring day, run the music, and then you have samba, you have salsa, you have
Samba.
samba, any kind of dancing, and you will enjoy it. And it is a good energy. And immediately people start to say, okay, wow, that's actually a very good idea. Why not to be like a routine? And we found from psychological and behavior studies that if you repeat something for 60 days, 66 days in a row, it becomes a habit. It becomes like addiction. So I said, okay, if we know that every day after you eat your lunch or you eat your dinner, go for 10 minutes, listen to music and dance. And then it becomes like a daily habit that people can do. I'm just giving you some ideas how you can make the culture working in the right direction with you.
I love that. So I'm going to start this habit today. Thank you so much for 10 minutes. It's an opportunity for me to. This is such a good thing. So how to merge what you like for better options to help your life. So it's really interesting. And think about other questions, and of course, everyone wants to know a lot of stuff from you, Dr. Osama, but let's talk about your career a little bit. Come back a little bit back about your career and as an inspiration for everyone. So what advice you give to the medical physician postgraduate students who are beginning this new and exciting phase in their lives as they are studying, they're choosing the specialty they are looking for? So what advice you have for them?
I give them three advices. Okay. The first advice, go always after your heart. Whatever you love, you will excel in. So don't work in a specialty that you don't like. Work on the specialty that you like. Explore yourself to everything. And once your instincts and internal feeling is telling you that this is something, or if you have a passion from the beginning for something, some people love pediatrics, some people like OB/GYN, some people like surgery. Whatever you love, go ahead immediately and pick that specialty because you will excel in everything that you love. And when you go to your work, you go with love. You think that I'll be productive in that field, rather than it will be a routine work, tedious work, boring work, and you burn out yourself quickly. So go first with things that you. The second is that in every specialty, whatever the specialty is, there is a niche. And if you excel as much as you can in that niche, like for example, in the whole diabetes, there is type 1 and type 2 and young and adults and here and there and compare. Just pick one that you like most and do as much as you can and expand yourself. In no time, you will be recognized across the globe in that area because this is the area that you excel in. Not in everything, but just pick one and try to focus on that one. And then try to excel in that one. The third advice, anything that you love and you do research on it. Because research is a powertrain for advancement. So if you have a research in something and then you take that research and you translate into clinical practice, it will be amazing. You are translating everything in clinical practice, you research it, you translate it in clinical practice, and then by that you will be recognized in that field. everyone will know about Gabriela because Gabriela focused on that area, her research in that area, her publication in that area, and so on. But the biggest mistake that anyone will do is that I will be a broad spectrum. If you are broad spectrum, you are not in the radar. No one will see you. But if you are very specific to the target, working on that target, something that you love, you will accept.
This is so incredible. The first question I did, it was about ask you about the Dr. Osama behind Dr. Osama. So this time you just showed to all of us you love what you do. That's why you're the best, and you're what you do every day because you love what you do and something that make you happy every day. So it's something important to our students too, for everyone actually. So make something that you love and your passion too. This is really good to hear, especially from you, Dr. Osama, as you have a lot of experience and background that is incredible. This is something that we need to think about it and choose about it.
You know, Gabriela, let me tell you, I had been always fond of technology, okay? So when I was a young diabetologist sitting in my clinic, seeing my patients, and hearing about something called insulin pump, it was very, very new at that time. No one knew that much about it. And I was basically some nights I cannot sleep thinking of this pump and how that pump works and how the pump will deliver insulin and how. And then I decided on my expenses to go to Germany to learn about insulin pump. They were advanced at that time in insulin pump. It was not that much in the US at that time. And it was a company in Switzerland that make it, and Hochst in Germany started to take license to produce those machines. And it was a bigger machine and then a smaller machine and like a Swiss watch working. And I learned that technology. I was extremely happy that I fulfilled one of my dreams to learn about that technology. And then it became, at that time, very expensive to go in any place to implement it. So I went to Saudi Arabia because they have all the resources to make a program. Then I moved to the US after that. And in University of Missouri, where I started, no one heard about insulin pump. No one know about insulin pump. There was only 4 or 5 pump programs in the entire nation. And then we started an insulin pump program, which is now one of the best pump programs in the nation. And we were able to have that program and implement that program, and it became a very famous program. And then I moved the following year to Joslin and start all other technology research and so on. But it started from a passion for something. And then you go and learn about it.
Yeah, and efforts, and also keep doing. As you said, just choose something that is like unique. Choose something, just one thing, and go through. Don't be like just
Distracted.
Yeah, that's the point. Yeah, so I think this is something interesting also for Brazilians and our physicians, because Brazilian, something that I saw as a difference, as a cultural difference between Brazil or Latin America and US and Canada, North America. Here in North America, people, they are more specialized. In Brazil, usually people do a lot of stuff. They know something like as a specialty, but they pick a lot of stuffs as well as something that they know. But if you want to be part of, if you want to be like different, if you want to be recognized, if you want to be better in something, choose one thing and be the best you can in that one thing. So your story is amazing.
Let me get you analogy that will fit with Brazil very well, okay? You know, I love Brazilian soccer, the football. On all my life, I love the Brazilian football. And when I was young, I saw Pele playing in Egypt. He came to play my team. He came with Santos team to play against my team, and I went to the stadium. I saw Pele playing. So let me do an analogy. A good football player can play very good football. You can, you play football, and you play with your head, you play with your feet, you do everything, but you will excel in one position as a defender, or a midfield, or an attacker, or an offender or a goalkeeper. You have to pick one that you have the best. Okay, your coach can tell you, but from internally, I found myself in the defense. I do very well. I will play only defense. I will be the best one in defense, or I be the best one in the middle field, or I will be the best striker in the stuff. People have to pick something. They are good football player. They can play anywhere. The goalkeeper can go and shoot penalty and can score, but he is the best in being a goalkeeper. So be a goalkeeper and train yourself to be the best goalkeeper all the time.
I love the analogy, and I think our physicians in Brazil, they'll totally understand, because we love soccer and it's an opportunity. So go for Brazilian students, doctors in Brazil, especially from MEDBRASIL. Keep doing what you love, and also choose what makes you the best in your specialty. So thank you so much, Dr. Osama. I think that they had a really nice time just hearing from you. Stuffs they cannot like find through internet or the technology for AI or something like that. It's about your love, patience, and also your history, about the details about your life. I think it was a good opportunity for all of us. It's a pleasure and honor for us. And I don't want to take more of your time. I know how busy you are and how much stuff you have to do it. And before we wrap up, we love to record a short message from you to our future students in Brazil. And that's all. Thank you so much. Appreciate it for everything, for your time, and for our interview.
It is a pleasure. It's a pleasure. And my brief short message for everyone: believe in yourself and believe in your future. Have a hope. You will get your chance. Excel in that chance, and you will be the best doctor ever.
Thank you so much, Dr. Osama. Thank you.